Okay, we might as well just get started. But first, do you guys want to introduce yourselves to everyone who's on?
Sure. I'm Dr. Gilbert. I'm an internist and a fertility specialist in Manhattan, as well as and I've been working with COVID patients since the very beginning of the pandemic, treating sick people as well as vaccinating people. So I'm really excited to be here tonight to talk to you about COVID and answer questions you may have.
Nice. I'm Dr. Lawrence Neshiwat, internal medicine endocrinology in Yonkers. I've also been treating and vaccinating patients since the beginning of the pandemic and enjoy discussing the topic with patients and the public.
Okay, great. So we're waiting on one more doctor, but we just might as well get started. So as I said in the pinned comment, if you have any questions, make sure to add them to the chat box, and we will answer them as they come in. But just to start off, I think a good question to start with is, are unvaccinated children, especially those in an age group not eligible for the vaccine, more vulnerable because of Omar Khan? And are there any studies showing that children might potentially become ill from this variant?
Want me to take it? Can I take it?
You can take that.
Okay, I'll take that one. So I think that anybody that's unvaccinated is more susceptible to Omicron, whether it be children under 5 or anybody. And there are a lot of people not vaccinated. So yes, absolutely. Now, are they going to get very ill with it? We're not seeing that right now, thank goodness. You know, we don't really know enough about it, honestly, because we haven't seen enough cases here yet. As of now, it looks like people, children and adults are not getting very sick with it, thank goodness. But I think that we don't know enough yet. So this is, it remains to be seen. And as far as the second question was what studies in terms of the vaccine?
Yes.
And the efficacy of it with Omicron, was that the question?
Yeah, but
yeah. So, we don't have enough studies data with that as well. Unfortunately, so much is unknown. It looks like the vaccines are probably not as efficacious against Omicron as they are against Delta, for example, or the original variants. But on the other hand, there's absolutely some efficacy that will give some protection. So the people who are vaccinated, who are getting Omicron, are not getting very sick at all so far, fingers crossed. So the vaccine definitely does play a role in helping people get less sick. So it's still very important. And it also protects people against spreading any variant. So in other words, if everybody gets vaccinated, there are no variants because there's nowhere the virus to go. So that's the other reason it's just.
Yeah, and so for talking 5 to 11 age group, so far, how do the vaccines appear to be in terms of safeness and efficacy?
The vaccines compare. I'll take this question. They're very efficacious against the coronavirus, as well as preventing disease and the sequela of the illness, no matter at what age group. The more that we are seeing people that are vaccinated, the more that we're finding that people that are vaccinated are less likely to get the severity of the illness. So it is efficacious at any phase, at any type of vaccine, whether it's the Johnson & Johnson or the Moderna or the Pfizer. The most efficacious, I would say, of the three are the two that are leading the pack is the Moderna and the Pfizer. They seem to have the most out of the three to have in benefit. So whether they are in any age group or no matter what level of vaccination, those two, the Moderna and the Pfizer, are the most efficacious against this coronavirus, and even in preventing the hospitalization and the severity of illness, I feel that they are the best.
Absolutely. I completely agree with you, Dr. Neshiwat. Yes.
I am pleased to serve the community and any locality, and no matter what language they speak. I am fluent in Spanish and as well, and in Arabic as well. So I find in the city, in our area, where there's a lot of patients that are afraid of getting vaccination, they tend to want to have someone that they can relate to. No matter what, we should spread the word that we are able to communicate and be out there as physicians to help alleviate the burden of fear. So that's why, as a physician, and all of us, whether we're nurses or doctors or in any medical field, we should give the community the feeling of security, that we're there on their side. We're not there to give them something that's going to hurt them. The more people we vaccinate, the more likely they're going to feel the less of the severity of the illness. It's almost like having a wildfire in a forest. The more you put in the path of that fire, the more blockage, the more protection, the more less likely that the virus is going to spread. So I feel giving more people the vaccine is going to allow the virus to live in more people, and it will sooner or later be much more controllable.
Yeah, and now that we have Dr. Frank here, do you want to just introduce yourself? We can't hear you. Okay, well, while we try to figure that out, we have another question someone just asked. So it says, should we be extra cautious with our kids under 5?
Is Dr. Frank taking that one? I don't think she can.
I don't think we can hear her.
I mean, do you want me to take it?
Yeah, go ahead.
I mean, I think yes. Even though it looks like young children are not getting very sick with COVID, I think the problem is we don't know what the next variant is going to be and how it is going to affect children. And because this age group is not vaccinated, I think we absolutely want to protect them. And we also know that COVID affects brains. And so I wouldn't want COVID going into my child's little brain. And also, children are spreaders. So even if your child doesn't get very sick, and hopefully they don't, they can still spread it to somebody else who can get very sick. So I think we need to be extra cautious for several reasons.
Yeah, and I know we are kind of aiming this live towards parents. So another good question would be, will my kids be able to go maskless at any time at school soon?
I'll take that question. I think masks have been very good source of protection for whether it's other children or the teacher or some form of transmission of viruses, especially the coronavirus being so rampant and so easily transmissible. At this phase, I think it's very hard to say when it's gonna happen, but hopefully in one day, especially children who need to be in school and see others without having so much of this fear from coronavirus. However, at this phase where the virus, especially the new variants, are so easily spreadable, it's very difficult to tell. We're going to wait on the science and how the CDC is going to give us direction as to when that can happen. I think I'm going to leave it to the scientists to tell us when masks are safe and when they're not.
Yeah. I'd like to add to that. Again, I completely agree, but I think that masks are so very important. I mean, I think I'm seeing too many people feel like once they're vaccinated, they're comfortable and they don't need to wear masks. But we're seeing so many vaccinated people still getting coronavirus, they're still getting COVID, and then they're spreading it to other people. And, you know, in the schools, the thing that's been really remarkable is that even though there are plenty of children in the school that are positive, because I've tested some of them, they're not spreading it. So the other children are not getting it. And that's because of the masks. That's because the children are sitting next to each other, but they're all masked. So I am a very big fan of the mask. When are we going to be able to take it off? I'm not quite sure. I don't think any of us know, but I think that we shouldn't be in too big a rush to take off our masks. I mean, I'm boosted and I wear my mask everywhere. And I think, the children should as well. And, you could say risk benefit. Well, it's not good for the children. They want to express themselves. They don't want to be in school with a mask. And I totally get that. My 7th grader doesn't. But on the other hand, I think it's better than the school system closing down. I think they're better off wearing a mask and being in school than being on Zoom.
Correct.
Yeah, I'm a high school senior at Scarsdale High School, and so I've had the last 2 years being in mask, and I honestly think at this point everyone's just used to it. People wear different colored masks depending on their outfits, people match, but it's just kind of a part of the routine, and I don't think any time during my last year in high school it's going to get changed.
It won't. And if it does,
Yeah. Especially not in Scarsdale. Okay, so just a reminder, if you have any questions, you can add them to the question box at the bottom, and we will answer them as they come in. But as we have no more questions right now, we will move on to one of my questions, which would be, why is Omar Khan seemingly more contagious? I'm not sure if there's any data on this yet, but why is it right now seeming to be like that?
I don't think they really know exactly why it's so much more transmissible, but they've found that different strains of SARS have been more easily transmissible than the original COVID-19 that started. But I think the data is not yet clear as to why. It seems to be in certain countries where there are less vaccinated people. But the disease itself doesn't seem to be any worse than the previous. And people that are vaccinated, they seem to tolerate it better than they did originally that were not vaccinated. So I think vaccination is going to give this virus less of a place to live. So the more we vaccinate, especially booster vaccines, the less likely that this is going to kill many people. So no matter how we look at this disease, there's no bright spot. The vaccines are our only hope and our only way of protecting. It's an extra armor against this virus. So the more we vaccinate, the less likely these vaccines are going to affect us badly like the original COVID did.
Yeah. I mean, some viruses are just, better at the immune system than others. So why Omicron is, I completely agree. We don't really know. But I just say that we're only at this. I mean, if we all remember, we don't all remember, but if we look back at smallpox, or we look back at polio, people were dying or crippled, and then vaccines became mandated, and we don't see polio anymore. And I just think it shows us that vaccines can really work. So we might still see coronavirus in years to come. Hopefully it'll be like the flu, so people will get sick, but it won't be the same as what's going on right now. But I think that, again, the only way really out of it is to get everyone vaccinated, boosted, and keep your mask on until that happens, because it's going to keep coming until we get people vaccinated.
Yeah, I think that's a good transition to a question that we just got asked. Any tips for what to say to friends who aren't getting their booster as quickly as I wish they would?
Well, I think that the people who are not getting their booster need to realize.
Sorry, I don't think we can hear you.
No.
We just lost your sound.
Am I still there with you?
Oh yeah, we got it back.
Okay, sorry. I have to charge the phone. So unfortunately what's happening is that the antibodies are decreasing, so they're not fully protected anymore. In fact, they're not protected. They need another booster to make more antibody against the virus. So I think it's they're not.
Yeah, and this is another question about the booster. Why is it important for people to get the booster shot right now instead of waiting for a booster that may be potentially tweaked specifically for Omicron?
At this phase, when we're not sure how Omicron, why it's spreading so rapidly, I think getting the booster is our only savior against the severity of the illness. COVID-19 and the disease that Omicron is seemingly presenting is a disease more than a viral infection. It's not just a common cold. This is a disease condition. So to treat a disease with any life-saving measure is very important in the beginning. Until they come up with a better treatment option, I think taking the vaccine, which seems to be our only savior against being on a respirator, I prefer to take the vaccine, even if it's a third or fourth dose, than to take on the virus itself, where we're not sure whose immune system is capable of fighting it. So it's like it's almost like a wildfire. If you don't put enough support or prevention in its path, it's going to take out a lot of the homes and destroy a lot of lives. So I think taking on the vaccine right now until we do have a better treatment option. Of course, we have other things that we could use in the hospital setting, but I prefer to take something to prevent people from going to the hospital.
But I also think we don't know when a booster is going to come out for Omicron, and by the time that happens, there may be another variant. But right now, they can get immediate protection. 100% protection, no, but it'll protect them enough that they're not going to die of Omicron, and they probably won't get very sick with it. So I think that the sooner that people get boosted, the better off they are. Because again, there'll be more variants and more variants. And so if we get people boosted right away, we're not going to keep getting variants. So the most important thing is for people to get boosted as soon as possible. And again, it will protect them partially. But to wait for another booster, again, we have no idea when that's going to come. And then it may be good for Omicron and not for the next variant. Yeah. So I think we don't just keep waiting and waiting. I'm advising every one of my patients, get boosted as soon as you can.
Yeah, and that's a good lead into the next question. Who should take the booster before 6 months from the last second dose?
I'm sorry, say that again.
Here, I'm going to pin the comment so you can look at it. But who should take the booster before 6 months from their second dose?
Yeah. Do you want me to take that, or you guys want to take it? I mean, anybody immunocompromised. So if you have an underlying condition that affects your immune system, then you should get it before 6 months. So I think most people know if they're immunocompromised or not, but HIV, autoimmune diseases, people on chronic steroids, they should take it sooner because their immune systems are such that they probably didn't make it sufficient immunity to begin with, and so they need a booster even sooner.
And also people
who take and anyone who took the J&J vaccine. Anyone who took the J&J vaccine should also get a booster immediately and not wait 6 months, because J&J did not do as well. In my opinion, and I know that Dr. Neshiwat said the same thing, is I would be using an mRNA booster. So if I were boostering a J&J, if I'm boostering J&J, I would take Moderna or Pfizer and not J&J.
Yes.
Dr. Frank, I think we can hear you now. So if you want to just introduce yourself quickly.
Hello, I didn't realize I was on. Oh, nice to be here. I've been listening, but somehow couldn't get on. Hi, I'm Maura Frank. I'm a general pediatrician, retired now, but I worked for over 30 years at New York Presbyterian Weill Cornell. So happy to join, and I'll kick in when appropriate.
Welcome.
Okay. I think another good question is, in your opinion, where are the most reliable places to look for information and to get clear information about the virus and vaccine at this point?
So if we're talking about general information, definitely the cdc.gov, and specifically to appropriate for pediatrics, the American Academy of Pediatrics website, aap.org. And there is a piece of that website that you'll get directed to called healthychildren.org. And it has wonderful information for parents and for kids about the vaccine, including videos. They're a lot of fun to watch.
I think we got a question earlier. Let me pin it. Is the vaccines for children different from the adult vaccine?
Different from
the adult vaccine?
Yeah, it's a different dose. Children have very active immune systems, so they actually get good protection with a much lower dose a vaccine, and it's a little different between Pfizer and Moderna, but approximately a third of the adult dose. And that's what's mainly different about it. The side effects for the vaccine for children in the studies and since then have been mild to moderate, but very similar to the side effects for teenagers. So mostly fatigue, headache, and soreness in the arm of where they got the vaccine.
Okay, we just got another question. What would you say to someone who has accepted all the guidance to this point, but is starting to get weary and a bit thrown off by what feels like mixed messaging from government agencies and experts?
I believe that government and the scientific community should not have the same platform. The government should allow the scientific community to make decisions based on healthcare. When government involved and the scientists become politicians is when you start getting mixed messages. I think they should leave decisions on healthcare to the scientists. These are the people that are best committed to this. If someone wants to have the electrical system in their house fixed, they should not be asking a plumber to fix it. They should be calling an electrician. When you have a healthcare crisis like we have, we should allow the scientific community to take control and not have politicians involved.
So having said that, you know, some of the problem is the information about this virus comes in pieces. So what seemed to make good sense scientifically a month ago may not make sense now. So I would ask people to have some patience with that and some understanding that really there have to be changes based on what we learned about the vaccine. I'm sorry, about the virus.
Yeah.
And just a little plug to Vax Up Westchester. If you want up-to-date information on our website, we have a resources page that we populate different links that are important. And we have like a breaking section about breaking news and different updates. So we can always look to that for new updates.
That's great.
Yeah.
Okay, our next question is, can we mix vaccines? If we took 2 doses of Moderna, can I take the booster Pfizer?
Yeah. So yeah, absolutely. Vaccines can be mixed. I get this question all the time. So which booster should I get? And the answer is, I don't know. There is no study. There are no studies. And so some people say mix and match. Some people stay with the same one. I don't honestly think we know what is the best thing to do, and we're not going to know for quite a while. But I do think that they're all good. And I don't think it's going to matter that much if you get 3 Pfizers or 3 Modernas, or you decide you're going to mix and match. There's just no studies on it right now. But as I said, I think all the mRNA vaccines are really excellent. So you can't go wrong. But yes, they can be mixed and matched. And the only time I would absolutely mix and match is J&J, where if you've gotten a Johnson vaccine, I strongly believe that the next step is an mRNA vaccine. Either one.
I think that, yeah, just to reiterate, with the J&J vaccine, there has been some study showing that boosting with Moderna, for example, can actually give you much better protection than boosting with J&J.
Yeah,
That's correct.
Yeah, yeah.
Okay, and just as a another announcement, just make sure to ask any questions, and we'll be happy to answer any of them. But we wait for more questions to come in.
Can I throw one thing out just while we're talking? I'm so sorry to interrupt.
No worries.
I just would love to tell everyone also that, you know that the CDC is saying go ahead and get your flu shot and your booster together. And while it can be done, it can be done, I'm just seeing a lot of people having a lot of side effects doing them together. So if you're not going to be able to go back to the pharmacy or your doctor, get them together. But if you don't have a problem getting them separated, you might want to separate them because people are getting, really feeling very unwell doing it together. And a plug for get your flu vaccine, because it's a bad flu season already, and flu and COVID, it's a bad mix. And now we're testing people for flu and COVID because it's hard to tell what they have. And so I think get your flu vaccine.
Yeah.
Okay, our next question is, Are fears of heart inflammation from the vaccine overstated? And what are the risks from it versus heart inflammation from the virus itself?
Good question.
Great question.
Great question. Who wants to take that one?
Well,
You want to take it?
go ahead. You could take that.
Oh, okay. Yeah. Okay. Yeah. So that's a great question. So I think, people ask that all the time. So I am much more afraid of the virus than I am the vaccine. The risk of any heart inflammation from the vaccine is extraordinarily low. I mean, extraordinarily low. But the risk of actually having a cardiomyopathy, a heart inflammation from the virus, is not as low as people think. And in fact, it's not just coronaviruses. Many viruses can cause a viral cardiomyopathy, in other words, inflammation of the heart. This is just one of many viruses that can do it. And it's just now that it's in the media, people are realizing it. But I have a very healthy respect for coronavirus, and I'd be much more scared of having an inflamed heart, a problem with my heart from the virus itself than I would from the vaccine.
Yep. Yeah. And I can add to that a little and agree absolutely that in children, there have been cases of myocarditis, pericarditis, as you said, a very small number, usually in males, actually teenagers and young adult males. And that the symptoms have been very mild and they have resolved within a few days. And I think that's important to note. Also importantly, plugging again for vaccines for children, the studies pre-vaccine approval, there were absolutely no cases of myocarditis or pericarditis in the 5 to 11-year-olds, which is important. And so far that's held true after 4.3 million 5 to 11-year-olds have received vaccine now, at least one dose. And we're not seeing myocarditis and pericarditis in this age group. So that's very important to note. Another good, strong argument for not being afraid of the vaccine, being afraid of that side effect.
The virus can cause long-term effects of the heart. So once you get a cardiomyopathy from the virus, it doesn't mean that then you're going to be cured from that or it's going to go away. You can have long-term damage from your heart.
It's like the data. It's like the data they're showing in Gibraltar. They're saying people that were vaccinated, that island that have almost 130% vaccination rate, are getting Omicron. The problem is the data that they're getting is a lot of it is from the media. When you show 130% of the people who were vaccinated still getting Omicron, they're not seeing that the people that are actually coming down with Omicron and are really the people that were not vaccinated out of that population. The 130% of the people that they're saying got it is the booster shots that have been vaccinated. They're counting that as 130%. But the island only has like 30,000 people in Gibraltar. So there are some cases of Omicron, but it's not because they were all vaccinated. We're not protected. This is where information that comes from the media can sometimes get skewed to make people think that the vaccines are hurting people, are causing side effects, or not protecting. It's not true. The vaccine protects, and it's protecting against the severity of Omicron, and it's protecting patients and people against the COVID virus. So I think no matter how we look at it, unless the data is coming from the scientific community, I don't base any security in taking that information. So I would wait for the CDC to come up with a reason why anything is a side effect of the vaccine before we are fearful of it. The vaccines are safe, and there's very little data that shows they cause any kind of disease in people.
Yeah, I think that's a good lead into the next question. What do we know for sure about long COVID, and how much more of a threat is it than long-term side effects from the vaccine?
So,
I'm sorry, what was the second part of that? What do we?
How much more of a threat is it than long-term side effects from the vaccine? We're talking about long COVID.
So, I'll mention in terms of long-term side effects from a vaccine. Well, this vaccine isn't out that long, but we know that vaccines don't have long-term side effects. So when we look at a vaccine, and this vaccine is no different than any other vaccine, honestly. It's a slightly different mechanism of how the protein is introduced into the body, but it's the same thing. Make an antibody, make a vaccine. And no, the vaccines don't have long-term side effects. I mean, when they have side effects, it's usually within the first 6 weeks of vaccination, but we don't look down the road and say, oh, we gave a vaccine and now 5 years later, 10 years later, somebody has a side effect from it, because vaccines don't generally, they don't do that. And this is not any different. Long COVID, I think we have to be worried about long COVID, because while many people don't get it, I have many patients who have gotten it, and it's not pleasant. It's not good. I mean, COVID can affect your heart, it can affect your lungs, it can affect your brain. I mean, it can affect a lot of parts of your body, and there's no treatment. And so either they're going to heal themselves or they're not going to heal themselves, and that's not a good place to be. So again, I'm much more worried about long COVID than I am about any long-term theoretical problems with the vaccine.
See, I've had patients that are diabetics that originally, that when the COVID-19 hit, a lot of the patients that were diabetics, that were very sick and very fragile, got the disease and long-term side effects. They got stroke, they got heart attack, they ended up on respirators. These are the ones that are suffering the long-term side effects, not the people that are vaccinated. I've yet to see a patient and I've been vaccinating people since almost 12 months already, 9 months, and they've been doing very well. I've yet to see anyone develop more than a redness or irritation of the arm that was vaccinated. To tell you the truth, the vaccines have been very safe, whether they're Moderna or Pfizer or J&J. So I don't know where the data is coming from to scare people away from the vaccine, but it's not valid to me.
The other comparison that might be helpful is that in children who have not been vaccinated, because most of them weren't until very recently, there is a syndrome called the Misc, the multi-system inflammatory syndrome in children, MIS-C, and that is a result of COVID, not of the vaccine, and that is a long-term side effect of the actual disease, and in which there's inflammation of multiple organs in the body, the lungs, the heart, the GI tract. And that's not that well understood yet, but it's being studied. And it's similar to other things like Kawasaki syndrome, but it is really an inflammatory condition that's a result of the disease. So another thing that can be prevented by the vaccine.
But just to plug the masks again, sorry, because the vaccines are great and the vaccines really are very efficacious, I think we do need to remember that I don't think we can walk out after we get our booster and feel great about it and say, okay, now we're 100% protected and we know we're good to go. Maybe the next variant, we're not good to go. And so because we don't know and we're not out of the pandemic, I think, yes, vaccination will get us out of the pandemic. Get vaccinated, get boosted, please. But if you don't keep your mask on, we're going to keep spreading our variant. And if you don't get vaccinated and you don't keep your mask on, we're going to keep spreading COVID, even if it's mild COVID. And then we kept getting variants, we're not out. So I think if we truly want to get out of this, and we all really do, the way to do it is get vaccinated, get your children vaccinated, get your booster if you're eligible for a booster, which is 6 months after your mRNA vaccine or 2 months after your J&J vaccine, unless you're immunocompromised, then 2 months. And keep your mask on indoors with people, even vaccinated people.
Yep. Yeah.
Anytime you have a population of people, a population of subjects in a closed environment, whether it's a cruise ship, an airplane, anywhere where they're close together, or a classroom, they're more likely, anytime you bring them together, they're more likely to spread this virus, unless you have protection and have them vaccinated. These environments are gonna be the source of the infection. This is what we're seeing nowadays, since people are getting back on cruise ships or getting on airplanes, is that the virus can be transmissible. That's why they all have to everyone has to wear masks, and everyone has to be vaccinated and boosterized.
Yeah, and when do you guys, I think I saw on the news recently that 17-year-olds might be eligible soon. That's going to happen the next couple of weeks, right?
Yes. Yeah, very exciting.
Yeah, I'm excited. Hopefully I can get mine soon.
I'll be about, so fingers crossed, but let's see.
Yep.
Yep, so it's happening. It's soon-ish.
Yeah.
Yes.
Yeah.
Well, looking forward to hearing more about Omicron. And wouldn't it be nice if it's spreading all over, but it's not that bad a disease and it takes over? That would.
Yes.
Yeah,
God willing, we have a better new year coming.
Yeah. But I think that the fact that the vaccines are out for 5 and up is wonderful and amazing. And 5 is coming also. So, if we can get our entire population vaccinated, including the little ones, that would just be a game changer. And then we need to get the world vaccinated. So if we can get everybody.
Absolutely. Amen.
Kids are a very important piece of the puzzle here now, and they're really critical to get vaccinated because, now the kids are back at school, so that's becoming one of the main areas for, vaccine cooking. And, just in the last week, I've heard one of my grandchild's after school program, there was a child with COVID. At my daughter's school where she's teaching, there were 2 teachers with COVID. So, it's happening all over. So it's so important to, and getting a vaccine. We're seeing that obviously there are infections, even in vaccinated people, but so much less severe. And I don't know if you've talked about this already. I mean, the difference between when you look at who's being hospitalized, the vast majority are people who are unvaccinated.
That's why I think our government and the World Health Organization and the United Nations should get together and start vaccinating people worldwide. Once we do that, less likely and more of the control of this virus.
Yeah.
Less likely spread of the virus and less likely the mutations. The mutations are coming from the hosts that are not vaccinated. This is where this virus is running like a wildfire. And that's why we're not going to see the end of this until we vaccinate the whole world.
Right.
Yeah, COVAX is hopefully going to be very influential in that in the future.
Yes.
We got another question that says, how have you personally dealt with patients and other people in your lives who've been hesitant about the vaccine, and how successful has it been?
Well, I've had a lot of people who have been hesitant, and I spent a long time talking to people and explaining to them why it's safe and why it's important, and answering all their questions and trying to address some of the things they read that are incorrect, because there's so much information out there, in the media, and they don't know what to believe. So, when we talk about science, we talk about data, real. It's been really helpful, and I've been able to convince everybody with time and patience, except for people who are anti-vaxxers. People who are anti-vaxxers and truly don't believe in vaccination, they will never believe in vaccination. I don't have that conversation because there's no conversation to have. Yeah. And okay, that's their choice. It's a real mistake. But for the people who just are confused, they don't know, they're reading so much, what's right, what's wrong, they're scared, then I just think having a conversation with a healthcare professional who really knows about this is really important. And I recommend that everybody speak to their healthcare professional, that trust about it, if they have questions, or do a webinar like this.
Yeah, and if you do have questions and you don't want to ask them now, you can happily email vaxupwestchester at gmail.com, and we will get you in touch with someone to answer all of your questions.
It's almost like quitting smoking. I explained to them that you have to want to do something that's going to help prevent your illness and people around you. So if you decide you don't want to stop smoking and continue to smoke in an environment where you can harm yourself and others, then you continue doing that. But it's going to make it harder with time for people to travel, to go places who are not vaccinated. So we as the clinicians, healthcare providers, nurse practitioners, we have to spread the good news that the vaccine is safe. They're afraid that the vaccine is not safe, just like anyone that's initially trying to do something that they have never done in the past. make it comfortable for them.
Yeah, we just got a question. Dr. Neshiwat, if you're able to address the Spanish-speaking and/or Arabic-speaking population with kind of a summary about the urgency of the vaccine and Omicron and Delta with the holidays coming.
Of course, especially people that are undocumented, that are afraid to go out and get their information to the clinicians or places where they can go and get the vaccine. I tell my patients that only thing you need is something to show that you want the vaccine and picture ID to get the vaccine. And that is very simple. I speak Spanish fluently and I talk to them in Spanish because they're afraid and they're worried that if they've taken their vaccine, whether they've taken it in their country, whether it's a different Chinese vaccine or a different vaccine that we don't have in this country, I make them feel assured that they can take that vaccine in this country that we have, that is proven and is safe. So we can give them a booster shot of a different form that will conform to their protection. So yes, and especially when you speak their language, they will feel comfortable. And even if you have a translator or use a phone to translate your information, I think it works. So yeah, we have to be out there and try and get the community, whether it's the churches, whether it's a synagogue, whether it's a mosque. We have to talk to the parishioners and get that vaccine available to people. They're afraid to go out. We are there to provide that.
Are you able to say something short in Spanish or Arabic so when we record this, if anyone's watching can listen to that?
Yes, queremos dar la vacuna de corona en mi oficina en todos los lugares en la ciudad. Si alguien quiere vacunar con COVID-19 vaccine de Pfizer o Moderna, tenemos la vacuna y estamos esperando su noticia. Cuando quiere venir, podemos dar la vacuna a su tiempo. Por favor, venga a vernos y nos podemos dar su vacuna.
Okay, thank you.
To all my Arabic-speaking patients, أهلا وسهلا. احنا بيانكا's بنقدر نعطيكم الفاكسين from COVID-19. انت ما بتقدروا تيجوا علينا بنقدر نعطيكم الفاكسين بس احكوا معنا.
Great, thank you for that. And just talking more about the booster, why is it important for people that are living in communities with lower vaccination rates to get their booster?
Say that one more time.
Sorry. Why is it important for older residents in communities with lower vaccination rates to get their booster shot?
Yeah, so in communities where there's lower vaccination rates, that means there's going to be more COVID. And so they're at much higher risk of actually acquiring COVID. And so because even though they were vaccinated, their immunity is not nearly as good anymore because it's been a while since they got their vaccine. The antibody, we know, wanes. It goes down after about 6 months. So now they're at much higher risk, and they may be in a community where unvaccinated people are spreading COVID. And so they want to be protected.
We have been seeing patients that were not vaccinated with the booster. Their immunity does wean down, and they are more likely and susceptible to getting the variants of the COVID-19. So therefore, getting the booster will help boost their immune system higher and protect them even more. It's almost like having an extra barrier, another mask on to protect them even when they're most susceptible. So yes, a booster does definitely work.
What would you say to a patient that said, because there are cases of vaccinated people getting COVID, that the vaccine isn't effective?
I think the important thing is to remind them that while they might get COVID and have a breakthrough infection, they won't, very unlikely they'll end up in the hospital and very ill. I think that's the important point there. We can't say anymore, you won't get COVID, but you're protected against, and that's how the studies were done, severe illness, hospitalization, and death.
Right.
And I know this is kind of a topic that's been discussed a lot recently with the deadly flu epidemic right now. What do you think the possibility is of having a twin-demic this year?
I think that's crystal ball, you know. I think we really can't answer that. I'm gonna say hopefully not. But I think that if we want, you know, if we want to prevent pandemics, the way to do it is, again, it goes back to vaccination. So, you know, like the reason we don't see polio is because people are vaccinated. We don't see smallpox, people are vaccinated. If everybody got vaccinated against the flu, we wouldn't see much flu. If everybody got vaccinated against COVID, we wouldn't see much COVID, because the virus has nowhere to go if everyone's vaccinated. And so I think that if we want to prevent, you know, any more pandemics, which we won't be able to, of course, unfortunately, forever, I think the way to at least try is, again, get vaccinated. So get your flu shot, get your COVID booster, or get your COVID vaccine, your initial vaccine.
Okay, we have another question. What do we say to people who feel wary from all their life circumstances and are kind of nihilistic about the shot and the virus? And what do we say to people who feel they have religious conflicts?
Well, I've started, I guess. I mean, what I'd say is that I've seen people get extraordinarily sick from COVID who have not been vaccinated. I've seen people die of COVID that have not been vaccinated. So I think that while, you know, they may be wary, they may be nihilistic, they think they have to remember that people truly are dying of this and are continuing to die of it. And I mean, we're so lucky to have a vaccine in this country now. I mean, I think it's just a miracle, and they can protect themselves.
And in terms of the religious piece, it really, the most religious thing, and this applies to any religion, that you could do is to care about your fellow human being. And the way you care about your fellow human being is by helping to protect them. And that can come in many forms. And one of the forms that comes in is certainly, you know, masking appropriately and distancing appropriately, but it's also by vaccinating appropriately. That's the best way to keep others protected as well as yourself.
That's a great answer.
There is no religion that would allow the spread of any disease.
Right.
I don't understand where they're getting the religious exemption. Religion expects people to help others and prevent others from getting ill or getting sick. There is, as far as I know, there is no religious reason not to take this vaccine. As far as I know, most religious leaders advocate taking the vaccine and helping humanity, or having it as a moral obligation to your fellow man. Coming up with a religious excuse not to take it, to me, is far from reality.
And that goes for measles also, just to throw that in there.
Yeah. Yeah.
I never understood the religious exemption piece. So
I
completely agree with both of you. I think that's exactly right.
The only health condition that would warrant that, people on chemotherapy currently who are taking chemo drugs that can cause bleeding or any other issue at this present time. But once they're over that, they should be vaccinated if they haven't already been.
Yeah,
but taking on any excuses seems to be more out of fear of the vaccine. And this is where we are trying to take that fear away. This is almost going into a year since this vaccine's been out there. It is safe, and there's no reason to avoid taking it. The more people we vaccinate, the less likely this disease is going to come around and keep attacking us.
And I think the people who are in chemotherapy, except for very rare circumstances, they absolutely need it because they're immunocompromised. Yes. That's the population who truly needs to go and get vaccinated or boosted ASAP.
Yeah, and we're going to start wrapping up now. So if you have any extra questions you want to ask, you can put them in now. But I'm going to open it up to you three. Do you have any areas or topics that we haven't covered yet that you think are really important for our viewers to listen to?
I wouldn't mind throwing in a few questions that people ask me all the time. I'm not sure if people are wondering about these, but I get asked a lot about, my cats want to fight. I get asked a lot about fertility, and it absolutely, the vaccine does not affect fertility. I get asked about pregnancy. Is it safe in pregnancy? And you absolutely want to get it if you're pregnant because you want to protect yourself and your fetus. Pregnant women get much sicker than women who are not pregnant. It is safe in pregnancy. It's been studied. Yeah, so those are two things
And
I
it,
want to
it
add.
also, if you're pregnant, your baby will also get the antibodies.
Right.
Well, your antibodies that are produced in response to the vaccine will cross the placenta, and the baby will be protected when it comes out, partially protected, which is wonderful.
Yes,
Yes.
absolutely, absolutely. And there's no microchip, and nobody glows in the dark. I don't glow. Just to throw that in. I did a bunch of Zooms with
Right.
middle school kids, and they're reading about on TikTok that people are going to glow in the dark, and nobody glows in the dark. I promise you. And no one's being tracked. It's really a safe vaccine, an exciting vaccine.
Yeah, we got, Kenny said, I also hear people concerned about the vax effect on the menstrual cycles.
Yeah.
There's no other reason for fear of any other hormonal issue or disease causing. The vaccine contains none of that to cause any discomfort or any issue hormonally in anyone or cause any disease. The vaccine is a protein type mRNA vaccine that's been safe, it's been tested, and it's been around for decades. And we finally got something that will help our society and world to fight the coronavirus.
I think that people need to be more worried about the virus itself and how sick it could potentially make you. And while right now, thank goodness, Omicron seems to not be making at least vaccinated people very sick, we don't know the next variant, and there will be another variant, sadly. And so I just think that I'm much more scared of the virus. I mean, I have a healthy respect of viruses, working with HIV and COVID, and the list goes on. And I'm much more scared of the virus and what it could potentially do to you. We don't know all the long-term side effects of the virus right now. You know, we know a little bit about long COVID, but we don't really know how it's going to affect people long-term who have had this virus. And I think we're going to learn that, you know, down the road. So I'd be much more concerned about that than I would be about the vaccine causing, you know, any of these potential side effects that really, you know, haven't been panned out.
I think a good question just to end on is, what is the best way to talk to someone who remains reluctant at this point? And how do you recommend to go?
I'm sorry, I didn't hear that. Could
Yeah,
you say?
I didn't hear it either.
Can you hear me now?
Yeah.
Okay. What is the best way to talk to someone who's reluctant at this point about getting the vaccine or their booster shot?
Well, I think it's a lot of what we've been saying. I think that what Holly said especially is important, that, you know, think about what the virus can do to you and weigh the risks and benefits there. You know, you're getting a little poke in the arm. The vaccine goes in, the mRNA instructs the body on what to do. It makes the little, you know, the spike protein lookalikes, and then it disintegrates. It doesn't stay in your body. It goes away. It's not something that's going to sit there forever. It's gone. And then what are you left with? You're left with protection, which is wonderful.
Oh, and it doesn't affect your DNA. Let me just throw that out too, because it doesn't ever come in contact with DNA. We didn't show a slide about how it actually works, but it doesn't touch DNA. It doesn't come in contact with DNA, and it can never affect anyone's DNA. It's just a different way of making a vaccine, and it's a brilliant way. It's just a shortcut. It's pretty remarkable, but it makes a vaccine the way any other vaccine is made. It just cuts so many corners, and in the end puts the mRNA in versus the whole protein. Who needs the whole protein when you can give the the instruction for it? So it's just ingenious, and that, you know, so yeah. But I completely agree with, you know, what Dr. Frank and Dr. Neshiwat are saying.
I asked them, who do they trust most in their life, and which person do they give their ask for advice from for scientific reasons? Who do you want to tell you the risks and benefits of anything that's scientifically made? And I try to come up with a solution, not be against their wishes. I'm also their advocate. I tell them I'm here to keep you alive. I'm here to make sure you're going to be here and in the future. I'm not going to give you a medication or a vaccine or something that's going to hurt you. I want you to feel comfortable taking it. If you have any questions, I try to address the question in any language I can. However, if they're against it, I give them the opportunity to state their cause, why they're against it, and how they're going to continue. A lot of them come back to me and say, if I change my mind, you're going to be the one to give me the vaccine, which I kind of, I'm honored to be there for that. But I also tell them the longer you take, the more likely you're end up taking on the virus, and you may be strong enough to fight it off, but you may give it to someone who will die. You have to take that in your conscience.
No.
That you're carrying a loaded weapon.
I also share with people that, you know, I have a 12-year-old, and the day my daughter, the following day after my daughter turned 12, she got her vaccination. So you know, my daughter's the most important person in my life, and that's how much I trust this vaccine. I wouldn't give anything to her that I didn't think was safe. And the very next day, she got her vaccine, and we all really celebrated.
I think
And
that's
I would give it to a 5-year-old if I had one.
Yes.
Yes, I think that's a really good place to end. Thank you everyone for joining us, for Dr. Frank and Gilbert and Neshiwat for joining us today. If you have any questions at all, feel free to reach out to us by email or by direct message on Instagram. But this live will be available once I end it on our page, so if you want to refer back to it. And thank you so much for joining today.
You're welcome.
Thank you.
Thank you. Thank you. Bye,
Bye-bye.
everyone.